Okay, welcome to lecture number 4. Today we are going to talk about laboratory accreditation and accrediting agencies. Just like certification and licensure, this topic can be a little bit confusing, so I'm going to try to help clarify all this for you guys. So hang in there with me, okay? As usual, let's talk about our objectives. We are going to define accreditation and explain how it relates to healthcare facilities and educational programs. We will identify the major accrediting agency for laboratory science education programs and state its importance. Distinguish between accrediting agencies for hospitals and laboratories and discuss the accrediting process. And lastly, we will explain why some departments might seek voluntary accreditation and list which agencies provide such accreditation. So let's start with a definition of accreditation because we can't explain how it works if we don't know what it is. So the definition of accredit is to give official authorization to or approval of, or to recognize an educational institution as maintaining standards that qualify the graduates for admission to higher or more specialized institutions or for professional practice, which is what we are preparing you guys for. So we will also touch on the accreditation of educational programs in this lecture. So accreditation, when we talk about that in the context of healthcare and education, it refers to the public recognition by non-governmental organizations, and it's recognizing that they have attained compliance with certain standards. If these standards are met, then it is publicly stated that the institution or the facility meets the requirements, whether that is a school or a hospital or so on. Generally, accreditation is associated with better quality. So accreditation is a good thing. You want to be accredited. So now that we know what accreditation is, let's talk about who is accredited and why they need to be accredited. So educational programs, and specifically laboratory science educational programs is what we will talk about. Those can be accredited, and most are, and the laboratory specific accreditation agency is NACLS. You've heard us talk about that before. Hospitals are also accredited. They are usually accredited by JCAHO or TJC, which is the Joint Commission, and we'll talk about that one today. And then laboratories are accredited, separate from hospitals in a lot of cases, and they can be accredited by different agencies like CAP or AABB. And we will talk about those as well. So is accreditation mandatory? Do you have to be accredited? Well, accreditation is technically voluntary, but the reason that so many organizations are accredited is because it is often necessary to be accredited to benefit from certain privileges or rights, or to qualify for reimbursements from the government. So it's especially true of hospitals that participate in Medicare and Medicaid. Accreditation is really tied to the reimbursements for that. So we will start with accreditation of educational programs, and guess what, you guys? More letters. I know y'all are excited about all these letters. Okay, so the National Accrediting Agency for Clinical Laboratory Science, which is NACLS, that is actually the major accrediting agency for lab science educational programs, and our program is actually NACLS accredited here at UAMS. So the accreditation process for being accredited through NACLS is based on peer review by expert volunteers. It requires a self-study and a site visit, and the programs can be awarded accreditation up to 10 years. So in addition to NACLS, which is lab-specific educational programs, there is also the Higher Learning Commission, and they accredit degree-granting post-secondary educational institutions in our region. So colleges and universities that grant degrees that are accredited by the Higher Learning Commission, or the HLC. So the HLC is an independent corporation, and it's actually one of 6 regional corporations that accredit institutions in the U.S. And UAMS is Higher Learning Commission accredited. And since it's a regional organization, that means we are regionally accredited. So who cares? Well, you should care, and here's why. When you finish our program, you will all want to take the ASCP Board of Certification exam, and you will qualify to do so through Route 1. If you're not familiar with the routes, you can look those up on the ASCP BOC website, and it will explain the different ways you can become eligible to take the exam. So one of the eligibility requirements to take this exam through Route 1, you must have a baccalaureate degree from a regionally accredited college or university. Well, UAMS is accredited by the HLC, so check, got that one done. So the applicant for the BOC must also have successfully completed a NACLS accredited MLS program within the past 5 years. Well, UAMS MLS program is accredited by NACLS. Check. So you have those 2 eligibility requirements out of the way. Now, if you had not attended a NACLS accredited school, you are not eligible for the Board of Certification through that route. So you would have to find a different way to become eligible for that exam. So let's move on to hospital accreditation. There are 5 major players in hospital accreditation, but we are really only going to focus on one of those. So the major players, we have the URAC, the Utilization Review Accreditation Commission, the NCQA, National Committee for Quality Assurance, CARF, the Commission on Accreditation of Rehabilitation Facilities, COA, the Council on Accreditation, and TJC, which is the Joint Commission. So for our purposes today, we're really going to focus only on the Joint Commission because that's really the big player here. The Joint Commission was once known as the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO. You will still hear it called JCAHO. That's what many of us learned when we entered healthcare, and it's still called that today, although they have decided to just be the Joint Commission, or TJC. I don't hear people call them TJC. I either hear Joint Commission or JCAHO. So terms are interchangeable. They're the same when you hear that. So this organization is an independent nonprofit organization, and it's probably the most common agency that accredits healthcare organizations, so hospitals. The accreditation process for the Joint Commission requires an on-site survey, and that is followed by a survey report. If any deficiencies are found, the hospital has a certain time frame to respond to that report and let the Joint Commission know either how they fixed or how they plan to fix the problems. After that, an accreditation decision is made. So the Joint Commission can award accreditation for 3 years, or they have kind of different little certifications they can award for 2 years. And note here that the laboratory accreditation is only awarded for 2 years, and the reason for that is because of CLIA, which we will get into shortly. So there are obviously benefits to hospital accreditation. Otherwise, why would anyone put so much effort into it? Some of the benefits are national recognition as having met the high standards put forth by those organizations. It can reduce liability insurance costs and keep hospitals in compliance with healthcare regulations. It can also be a condition for reimbursement, so we sort of already mentioned that. And then it also allows for deeming status for Medicare. So quick side note, what is deemed status? Okay, so the government requirements for Medicare or Medicaid program participation must be met in order for healthcare organizations to receive federal payment. So hospitals are required by the government to meet certain federal regulations, which they do if they are accredited by the Joint Commission, and they're required to do that in order to get reimbursement from programs like Medicare and Medicaid. So this deemed status is achieved based on a survey conducted by a state agency on behalf of the federal government, or it can be achieved by being accredited by a national agency such as the Joint Commission. So basically, deemed status just means if you meet those standards, so if you are accredited by the Joint Commission, you are eligible for reimbursement through Medicare and Medicaid. So let's move on to the main focus, which is laboratory accreditation. And for this section, we're going to sort of break it up into the background of laboratory accreditation, accrediting agencies, and the benefits of accreditation. The background of laboratory accreditation really starts with CLIA. So CLIA was originally passed in 1967, but it was amended in 1988. CLIA 88 established quality standards for laboratory testing, and these regulations were based on testing complexity, so waived testing, moderate complexity, or high complexity testing. Moderate and or high complexity labs have different, more strict standards than waived labs. So they are required to participate in proficiency testing, patient management. They're required to complete quality control. They have different personnel qualifications, and they're required to maintain quality assurance. Waived labs, on the other hand, are required to enroll in CLIA, and they must follow the manufacturer's guidelines for any testing that they perform, which they are only allowed to perform waived testing. So CLIA plays a huge role in regulating labs, and you guys will hear a lot more about CLIA in Dr. Johnson's boot camp that is coming up. He's going to lecture for a couple lectures on CLIA, so you will get to learn all about that. So there are a couple of other organizations that are involved in regulating labs, and I'm just going to touch on those kind of real quick. They all have different responsibilities. So CMS, or the Centers for Medicaid and Medicare Services, is involved in lab registration, fee collection, surveys of labs. They train surveyors, help with enforcement of regulations, and they approve proficiency testing providers, and so on. The CDC, which we know is the Center for Disease Control and Prevention, is responsible for convening the CLIA Committee, or CLIAC. They provide scientific and technical support to CMS, and they assist CLIA with different studies. And then finally, the Food and Drug Administration. They are responsible for categorizing new test methodologies. So when someone comes up with a new test methodology, it goes through the FDA, and they determine, is it a waived test, or is this a moderate complexity test, or is this a high complexity test? So let's talk a little bit about CMS here. CMS has the authority to approve accrediting agencies for labs. So there are broad scope accrediting agencies that will accredit the whole lab, and then there are more specialized agencies. So CMS may also directly inspect the labs if they wish, and that can result in accreditation, and some states actually require that. So New York, Pennsylvania, they will require CMS to come in and inspect. CMS is also able to grant deeming authority to any agencies that are approved to accredit labs. So as long as the organization's requirements are equal to or more stringent than CLIA program requirements, they can be given the authority to accredit labs as well as approve or grant deeming authority. They can grant deemed status. So the major agencies that accredit labs or that are involved in accrediting labs include the CAP, which is the College of American Pathologists, COLA, which is the Commission on Laboratory Accreditation, the Joint Commission, TJC or JCAHO, and A2LA, which is the American Association for Laboratory Accreditation. And then there are also some accrediting agencies that are more specialized, such as the American Association of Blood Bank, and we've mentioned that they can accredit blood banks separate from the lab. We have also the American Society for Histocompatibility and Immunogenetics, which is ASHI, and then the American Osteopathic Association also. So we are going to discuss the sort of broad scope agencies a little bit more in detail. The Joint Commission accredits hospitals, but it can also accredit labs. So anyone who works in a hospital knows that JCAHO shows up unannounced for surveys. Usually they will make an announcement throughout the hospital when JCAHO shows up and say, we would like to welcome JCAHO to the hospital, which is really just a way to say, like, clean up your area, JCAHO's here. Anyway, so they have unannounced surveys, and this is really done to ensure that the hospital maintains their standards all the time, not just, hey, surveys coming, we got to get our stuff in order. So it helps the hospital to stay ready at all times. So when the surveys are at the hospital, the surveyors will use different methods to check on standards. So this includes tracer methodology, verbal and written reports from hospital employees, on-site observations and interviews, and sometimes other documents that are provided by the hospital. So for those of you that don't know about tracer methodology, what that means is basically the Joint Commission will find a patient chart and they will trace all of the steps that have happened in that chart. So they will go through if that patient had any lab testing done, they will follow up on the results, make sure all of that was done correctly. If they had any x-rays done, then they'll go through the radiology files and make sure that all of their stuff is in order and correct. So they kind of use that one chart to trace that patient's stay at the hospital and make sure that everything was done correctly. So the Joint Commission, they will also recognize laboratory accreditation from other organizations like CAP. So if the hospital lab is CAP accredited, then often the Joint Commission won't inspect the lab, or at least not in depth, because they trust that CAP has already done that. So the College of American Pathologists, or CAP, this is a common accrediting agency for labs. CAP only inspects clinical labs, and just like the Joint Commission, they perform unannounced inspections. These inspections consist of checking technical competence of staff, so they're going to want to see your competency sign-off sheets, observing the testing environment, checking procedures for specimen handling and transportation. They also check QA and QC records, past test data, calibration instruments, equipment maintenance logs, and the inspectors will also look at the validity and appropriateness of test methodologies being performed. So they kind of will come in and go through everything. They want to see all your procedures. They want to see that your competency sheets were checked off when they should have been, were they done annually, all that kind of stuff. And again, CAP is one of the organizations that their inspections are recognized by the Joint Commission. So COLA, or the Commission on Laboratory Accreditation. This is another agency that accredits the labs, and it's a physician-directed organization, and it is approved by CMS to accredit the following lab departments, and that would include chemistry, hematology, microbiology, immunology, immunohematology, which is blood bank, and transfusion services. So CLIA accreditations are recognized by both CMS and the Joint Commission, and they are also the only organization that has achieved the ISO 9001-2015 certification, and that's basically just International Standards Organization standards, and it's actually a pretty high set of quality management standards. This, I would say, is the second most common laboratory accreditation organization. You'll hear about CLIA. A2LA, you are not going to hear about as much. This is the American Association for Laboratory Accreditation. And it's a relatively new organization, and it was just approved by CMS for medical lab accreditation in 2014. So they are authorized to accredit all specialties and subspecialties, and they also offer accreditation for inspection bodies. They offer proficiency testing materials, reference materials, and product certification bodies. So this is a pretty new organization, so we'll just watch over the next couple years and see how big they get. So this is a chart from a CLIA update, and it actually shows which accrediting organizations accredit the most labs. So if you look here, I know CLIA is listed first, but if you actually look at the numbers, CAP is actually the highest number, so they are accrediting the most labs. CLIA is not far behind. So those are the two that I would say are the major organizations that are going to come in and inspect your labs. The Joint Commission, which is JC here, has about 2,000. So they're going to do about, what, a third of the number of labs. And then you can see everyone else is pretty small numbers. And then the A2LA, so as of April 2019, it looks like they were accrediting only 3 labs. So there's definite potential for growth for them. So we'll have to see in the future, are they going to be able to challenge CAP and CLIA, or maybe not. What benefits do labs get from being accredited? So they get recognition of testing competence, which is good because you want your laboratory testing personnel to be competent. It helps them to keep better documentation, so it's sort of that same situation where they usually have unannounced surveys, so they've got to be ready all the time. It helps improve quality of laboratory services and also helps the lab to maintain high standards, and being accredited promotes constant improvement as well because the accreditation agencies are constantly updating their checklist for their accreditation. So most accrediting organizations, like we've already stated, will perform unannounced surveys. So the hospitals and labs have to stay prepared pretty much all the time. So per CLIA, lab inspections have to happen at least every 2 years. So let's talk about the accreditation cycle, and we're going to use CAP as an example because most people are familiar with CAP. They are accrediting the most labs, so there's a good chance that you guys will deal with CAP at some point in your career. So CAP performs on-site inspections every 2 years in accordance with CLIA. And in the years when on-site inspections are not being done, the lab is responsible for submitting a self-inspection, and they use materials that are sent from CAP. The on-site inspections are based on peer reviews, so your peers will be the ones that will come and inspect your department. And their inspections require you to use CAP checklist, and that's what your inspectors are going to be using as well. They have a checklist, and that's what they're going to look at. You have a copy of that checklist also. And so those are updated annually, and they are also customized for the lab based on your lab's testing menu. So it's not going to have a bunch of stuff in there that's not relevant to your lab. It should be pretty customized to what you're doing. So I have posted a sample CAP checklist in Blackboard for you guys to review, and just a little side note, you may want to have this handy for your Module 1 quiz. It will come in very handy. It will be useful to you. So this is just a really good graphic that I found that sort of depicts the accreditation cycle. And I believe this one is actually CAP specific. So over here, kind of in the top right, you see number 1, request your application. So that's your initial accreditation. You request your application, you review the welcome kit, complete your application, then you go through the whole process up to number 10 where you do your self-inspection in the year that you're not being inspected on site, and maintain your compliance. And then once you've done your first year, on year 2, you actually just skip down. You don't have to request another application to be accredited. That's just for the initial accreditation. And so this is really nice. It just kind of walks you through like the steps that happen in an accreditation cycle. One last note, how does a lab become eligible for CAP accreditation in the first place? So if you're starting up a new hospital, starting up a new lab, and you are going to try to get your lab accredited for the first time, what are the eligibility requirements for that? This is something people don't really think about much because generally you guys are going to go work in labs that are already accredited and you're just already in the middle of that cycle where you're doing your reaccreditation every couple years. But just as a side note, so people will know, because this does happen sometimes that you get involved in this kind of stuff, CAP actually has a list of requirements and they are based on CLIA regulations. So to be eligible, the lab must have a qualified lab director, must participate in and be successful in proficiency testing, and must be performing patient testing. Now the last one is kind of a weird statement, like of course the lab is performing patient testing, but that is in there really, if you are not performing patient testing in a clinical or medical laboratory setting, then you're not really eligible to be CAP accredited. So if you're testing environmental samples at some lab down the street, that lab is not CAP accredited. They are likely accredited by some other agency. So it's specific to patient testing, medical or clinical labs for CAP. CAP also requires certain documents to be maintained and created, initially created and then maintained. Put those in the right order there. And those documents include a quality management plan, a chemical hygiene plan, document control process, a competency assessment program, test method validation documentation, laboratory director oversight documentation, and then information about the laboratory information system if applicable, which is likely applicable in every lab now. And if you'll also remember, CAP inspectors are going to come in and check a lot of these documents during your inspections. So even after they've been created, they pretty much have to be constantly updated and maintained so that you can remain in compliance with your CAP accreditation requirements. And that brings us to the end of our lecture. Number 4, I hope that wasn't too painful for you guys. I find this stuff pretty interesting and a little bit nuts with all the letters and the different organizations. So again, I'm going to encourage you guys to look over that sample CAP checklist and get familiar with it. One day you guys are going to have to deal with these checklists and know what it is, what it looks like, and what to do with it. So I encourage you to become familiar with that and print it out or download it to whatever device to have it handy for your quiz, your Module 1 quiz. It will be very useful. And if you guys have any other questions, comments, or concerns, please, as usual, get in contact with me. All right, and that brings us to the end.